I am Akanksha and I am from School of Nursing, and I am from Noida International University. Our today's topic is nursing as a profession, and here in this we will see that what is nursing. So here nursing is a discipline involved in the delivery of the healthcare to the society. It is a helping profession. It is service oriented to maintain health and well-being of the people. It is an art and a science. In short, we can say nursing is a profession where a person helps to the others to improve their health status. So what is the meaning of nurse, and from where nurse word come is, so the nurse word originate from the nutrix, which is from Latin language, and nutrix means nourishes, which means care. So nurse means providing care the others. So what is nursing? The nursing science is an independent applying science that synthesizes natural and social science. So here with this we can understand that in nursing science we are dealing with the human beings as well as the society in which we are living. Then nursing is a profession that helps human being and serve for health of human being. Nursing can assist individual to meet the basic need of human being and enforce the ability of self-care. So by this we can understand that nurse help a person to improve their health status, to help them to improve their ability of self-care, and also a nurse tries to meet the basic needs when a person is in need of the nursing assistance. So here we can say the what is abbreviation of the nurse. So abbreviation of the nurse can be: N stands for nobility, U stands for usefulness, R stands for rightness, and S for simplicity, E for efficiency. So in other words, we can say that a nurse should have these qualities as well. A nurse should be noble, nurse should be useful, nurse should be right at the time of taking any decision, nurse should be simple in nature, and a nurse should be very efficient in her performance. So according to the Virginia Henderson, uh, we can say, or we can define the nurse as: the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independency rapidly as possible. So here we can understand that in any stage of the life, either person is sick, either person is in need to improve his or her health status, or either person is in his last stage, then a nurse will help person accordingly to improve their health status, and to also to recover from their illness, and also to face their difficulties during that illness or sickness, and help to gain their health status as they were having earlier. So what is the basic principles of nursing? First of all is safety. So during any of the procedure, before doing any of the procedure, or during any other activity which is being done by the nurse, either it is documentation, either it is history collection, either it is providing care to the patient, or any other work, there a nurse should do that work securely. And another one is therapeutic effectiveness. Whatever procedure a nurse is going to do, whatever care nurse is going to give to the patient, that should be fruitful. Means whatever aim that nurse is having before doing any procedure, that result should come positively for the patient. Then another one is comfort. A nurse should make his or her client comfortable in any manner. Likewise, if she will maintain good IPR with the patient, then person will be able to share his or her feelings or thought to the nurse, or he or she can say what problem he or she is facing to the nurse. So comfort is very much necessary. Or before doing any procedure, you should make the patient comfortable by explaining each and every aspect of the procedure. So like that, there are so many aspects to make a person or your client comfortable. But comfort, it is also a principle of doing things in the nursing profession. Another one is use of resources. So whatever resources a nurse have, she should use those resources. She should utilize those resources to bring the outcome fruitful. Another one is good workmanship. A nurse should do his or her things in a completely skilled manner, or with the upgraded or updated knowledge, so that outcome uh, will come positive and effective. Another one is individuality. Before performing any of the procedure, any of the thing, a nurse should have the feeling of individuality, because this is a profession where we are dealing with the human beings. So we should think always that uh, the other person or our client is also a human being. So these are the principles. Then we will go and we will see, we will go to the next slide and we will see the concept of nursing. So what is concept of nursing? Here, to promote health, to prevent diseases, to help ill person, to healing, to assist the dying patient, to pass away with quietude, peace and dignity. And last one is the client is a holistic human being, including suffering person and healthy person. So here is nothing but, already we have discussed so many times in this class, that the same thing we have to see over here, that concept of nursing is nothing, just we have to remember that being a nurse, we should remember that we should work always to promote the health of the person. We should take those steps, preventive steps, to update the health status level of the community or the patient, to by spreading the disease. And all in all, we can say that we have to take such steps, preventive steps, by which we can improve the health status of the community and we can prevent the people from the diseases. Then another one is to help ill person, to healing. Then we should help them. Being a nurse, this is our responsibility, that we will provide all the nursing care under the supervision of the doctor, by which a person can heal easily. Another one is to assist the dying patient to pass away with quietude, peace and dignity. Means if suppose there are so many disease conditions are there, like cancer and all, in which it is very difficult to cure the person or to cure the patient. Then in that condition, if it is something like that, then a nurse should counsel the patient or should provide such environment or comfortable devices, or we can fulfill his or her spiritual needs, by which patient be will spend his or her peaceful days pending rest of the days will with peace. Then the client is a holistic human being including suffering person and the healthy person. So always we need to remember that we have to provide uh, such comfortable devices and such things by which we can improve the person's health status, as well as we have to maintain their health status. Then either by fulfilling their physical comfortable needs or by fulfilling their spiritual needs, so likewise we have to do. Then another one is the working place is not only in the hospital but also in the family, community and whole society. So we have to remember that a nurse can perform or deliver his or her uh, duties or his or her care not only in the hospital, even though in the family or in the community or in the society. So wherever a nurse rendering her service there, accordingly she should work and she should be honest towards the profession. Nursing is not only a science but it is also an art, because here it is not like that we are whatever we are studying that is enough and we will do. No, we are dealing with the human beings, then so we should be have that much skillful that if whatever we have learned that we should do, we should perform all those things as per the standardized manner, and we should do that accordingly in the manner of the in the nursing is not only a science but also an art where we should perform all the procedures skillful as per the given guidelines or standard guidelines. So next is the nursing science attaches importance to human being, living environment and the interrelation between human beings and its environment. Already we have discussed that we are dealing with the human beings and with the surrounding environment and the society. The nursing science is a gradually perfect and developing science. So as we know that this is the era where so many technology being developed and so many health issues are arising, so we need to update ourselves. So nursing is also a science which is getting update time to time, which is getting developing time to time as per the need. Then what all are the functions of a nurse? So first is caregiver. We have very much clear idea that the primary most function of a nurse is providing care. So the caregiver role has traditionally included those activities that assist the client physical and psychologically while preserving the client's dignity. Caregiving and encompasses the physical, psychological, developmental, cultural, spiritual levels. So in any manner, uh, either it is if you feel that you have to provide a care to the patient spiritually, then that care you should provide. If you feel that patient is in need of counseling, then you should provide counseling. And if patient is suffering with physical illness, then accordingly a nurse provides care to the patient. Another one is communicator. That is also a main function of the nurse. It is also very important How communication is an integral to all nurses' role. Nurses communicate with the client, support person, other health professional and people in the community. In the role of communicator, nurse identify client problem and then communicate these verbally or in writing to other member of the health team. The quality of a nurse's communication is an important factor in the nursing care. So communication is important and plays a very important role in the nursing profession. How? Because a nurse communicate so many things to the client and also passes the information to the client which has been given by the doctor. Nurses also passes the information to their colleagues, and also a nurse should have a good communicator also. She should clear the concept what she is going to say, how she is going to say. So she should be a good communicator as well. Another one is a teacher. Nurse plays a role of a teacher as well. How? We will see here. As a teacher, the nurse play uh, as a teacher, the nurse helps clients learn about their health and the healthcare procedure they need to perform to restore or maintain their health. The nurse assesses the client's learning need and readiness to learn, sets a specific learning goal in conjunction with the client, and teaching strategies and measures learning. So how we can say that a nurse plays an important role as a teacher? So nurse teaches to the people or to the client who came in front of her for the need to improve their health status. So there how a nurse plays a role by providing the health education to the patients or patient's family member, by teaching them the measurements by which they can improve their health status, as well as nurse understands same time whether how much a person can understand and how she should uh, teach those things to the patient or patient's family member. So here nurse makes a strategy to make them understand and plays a role of a teacher. Another one is client advocate. So in this role, the nurse may represent the client's need and wishes to other health professionals, such as relaying the client's wishes for information to the physician. They also assist client in exercising their right and help them speak about themselves. So here, uh, nurse is the only person as she is staying with the patient entire day, or 12 hours, 6 hours, 8 hours, or maybe more than that or less than that. So nurse is the only person who understand what a client want or what is the need of a client. So that need, that requirement, nurse only used to assess, and this thing only a nurse tells to the doctor that what is exactly her client's requirement. So here the nurse plays as a role of advocate. Another one is counselor. So counseling is a process of helping a client to recognize and cope with stressful social problem, to develop improved interpersonal relationship, and to promote personal growth. It involves providing emotional, intellectual, and psychological support. So here we also, being a nurse, we also play a role of a counselor. We helps the people to cope up from their worries and from their illness. So we are the one who provide emotional support to the client to understand the situation and also helps them to take the right decision. Another one is change agent. The nurse acts as a change agent when assisting other, that is client, to make modification in their own behavior. Nurse also often act to make changes in a system such as clinical care if it is not helping a client return to health.